Well, there's a big question. So research globally for us as a department and as a university is about trying to ensure that institutions, research institutions, universities and hospitals have got access to the right information at the right time, and about building a community of people to work collaboratively to share best practice. So over the last 21 years, we've tried to ensure that we build a platform and a community as part of our research and applied enterprise activity within the university. And to us, it's about enabling those organisations to be able to do research quicker, more efficiently, and also to have the right information to be able to meet ultimately patient needs. The biggest challenge is organisational change. So most people don't like change for very obvious reasons, and hospitals in particular are not like the biggest organisations up for big change programmes. So change is the biggest challenge that we have, and actually most of our work that we do is spent on concentrating on engaging with the institution about how to go about implementing platforms and how to go about actually improving their processes around research. And it's not easy and it takes a lot of time. But actually what we find is that once people begin to understand what the value is, they actually embrace change quite a lot. And again, going through back to my original point around building a collaboration, the opportunity for people to feel able to talk to other organisations and compare and share ideas is one of the things I think that really has enabled that. So the challenge has been about change, but actually it's turned into a positive in the way that we get institutions to work together. BC Platforms is quite unique in some respects because it, as a vendor or a supplier, it operates very much more as a collaborator. And from a platform perspective, a lot of the work that we're trying to achieve, both in medical research and about utilising new data science technology and techniques in medicine, is really complicated and challenging. And so really having a partner that is actually prepared to listen to us and to take criticism from us is very enabling, and it's allowing us to ultimately dynamically look at what our needs are and what we actually need to do to really deliver the kind of expectations that we have or what we want to do as a health system. So I think BC Platforms as a vendor is more of a partnership, and that partnership is valuable to us in being able to really ultimately deal with stuff that's quite complicated and people don't understand how quite complicated it is. So I'd say it's about the collaboration that BC provides us. So you're right, we've written large pieces of software. We write big platforms that are adopted in multiple countries, but writing software unnecessarily is a big burden, and it takes a lot of effort to be able to do that. We did look at our marketplace prior to working with BC Platforms, and we looked at lots of different options, but the principle was, don't reinvent the wheel. Go and find someone who's done something and is continuing to develop stuff. And ultimately BC Platforms capability against what we were looking at in other sort of platforms, both commercially and open source and academic, was the one that stood out to us in terms of being able to deliver most of our requirements, and like I said, to be able to work with us collaboratively to help us implement and change and adapt what we ultimately needed. So everyone's building data lakes, data warehouses, particularly in healthcare. The big challenge with that is, first of all, it's not as easy as you think. Anyone can build a data warehouse or a data lake. That's not particularly complicated technically. The technical challenge is around how to get the data in, because a lot of data in healthcare is still very unstructured. The quality of it can be very variable depending on where the data is coming from. And just having a data warehouse full of data doesn't really enable us to be able to do what we really need to be able to do. And clinically, I think the important thing is to allow clinicians to be able to interact with that data. So just having a data warehouse isn't enough. So really it's about platforms that sit on top of those data warehouses that need to be clinically relevant, and they need to have functionality and a user interface that's clinically meaningful. And that's where I think the challenge is to take what may be perceived as quite a simple problem of just shoveling some data somewhere, actually through to a utilization of that data which has clinical meaning. And that's where the big gap is at the moment, is platforms that really meet clinical need, either for raising or identifying a hypothesis clinically, or providing some sort of feedback from that data which is clinically relevant, may change practice. So I think those are the gaps, and that's where we've got to do more work. I think also the other challenge is, how do we actually bring multiple data sources together from different parts of a health system? So we need to talk about sort of open plan, what I call open plan care and open plan data, to bring multiple services together and to include research data to be able to really, progress what we want to all do, which is improve patient outcomes.